Here today. Who is responsible for ensuring that immigration levels match healthcare capacity? Is it you, Minister Diab, or Minister Michel?
So certainly as the Minister of Immigration, Refugees and Citizenship, my role hopefully is sort of clear and understood by now, and it is to manage our immigration system by, we just put a levels plan together, which is something that is done on a yearly basis, that we have targets for permanent residents, temporary residents. We now have an attraction strategy and francophone targets.
But who is responsible for the immigration levels to match healthcare capacity? Is it either one of you?
Okay, so the way it works is immigration is a shared provincial, territorial,
Yes or
federal
no?
jurisdiction, and so we work with the provinces and territories with respect to that.
Minister Diab, do you consider Canada's existing healthcare capacity before setting federal immigration levels?
So we have extensive consultations that happen. I personally did some as well all summer long, and part of that, those takes in stakeholders from the healthcare sector.
You do consider it?
Of course, everything is considered.
How many more patients can our healthcare system handle this year, according to your department's analysis?
Oh, that's not a fair question for immigration.
But, Minister, you just said you do consider it, so you must do some analysis.
So what I said is we have extensive consultations that occurs on a yearly basis when we set our target levels for permanent residency and temporary residency, and we take all the stakeholders' views, most importantly provinces, territories, municipal partners, economists, and and everyone in the many different industry stakeholders.
Do you know if your department does this analysis? Does the analysis for the immigration levels?
Yeah, a lot of our the information that we get related to the healthcare system is in fact in working closely with the provinces.
So you do analysis, or you don't?
We ask capacity questions to our provincial counterparts. They provide some of that information to us. What we did here overwhelmingly during our consultations that were people were looking to use immigration to bring in healthcare workers.
So you don't know how many more patients can be served according to your any more? You don't have any analysis of that, of how many more patients can be served due to immigration?
So again, the answer is pretty clear from my part. The extensive consultation we've done from many across the country was the question that was raised is how can IRCC facilitate and open pathways and work with provinces and territories to bring in healthcare workers.
We'll get on to the next question.
Yeah. Will you allow the witness to answer the question?
She wasn't answering. So
well, that's not your decision.
And then she took a new
make.
question. So that's
Witnesses
okay.
can answer how they choose. Thank you.
Minister Diab, how many Canadians don't have access to a family doctor in Canada right now?
I'm going to turn that over to the healthcare, but again, that's a provincial. I come from Nova Scotia. These are tracked, and I used to be a provincial member of the legislature and a provincial minister. Those numbers are tracked provincially, territorially. I believe the committee knows that, and I think most Canadians do.
So you know, though?
Well, I'm a federal minister, and
you don't know.
I can
Correct?
go on the websites and check for you if you'd like.
Minister Michel, how many Canadians don't have access to a family doctor right now? Just the number, please. Minister Michel, I'm asking you.
5.7, 6 million, around 6 million people. Around 6 million, 5.7, exactly.
The government plans to admit over 450,000 permanent residents into Canada this year. Can you confirm that every newcomer admitted under the immigration plan will have access to a family doctor upon arrival? Yes or no?
So the number's not accurate. Our 2025 permanent residence number is 325,000. But do you mind asking your question again?
Can you confirm if every newcomer admitted under your immigration plan will have access to a family doctor upon arrival? Yes or no?
So many that are arriving are doctors and physicians and clinicians and nurses and healthcare providers themselves who are actually here to service Canadians.
Minister Diab, are you aware that
47 seconds.
that Canada's population is growing faster than the supply of family doctors? Yes or no?
Well, we have 41 million plus in population. I'm pretty sure we don't have 41 million doctors.
It's the supply of family doctors. So in other words, we're immigrating more. You are immigrating more people than there are family doctors that they be able to serve Canadians.
We can ask the analysts about that, the stats on that.
So when the population grows faster than the number of family doctors, access to care gets worse. Can you agree on that?
You've got 5 seconds
I
left.
think it depends on people's age and health and so on. I mean, I've been to many countries around the globe where
So
it's
it
not a question of a
can't agree with
doctor to, there's a lot of collaborative care centers as well.
Thank you, Minister.